Hello, this is Dr. Famuyiwa, your friendly host of Fertile Talks. And today we're going to talk about the rise of at home tests. Um, so, um, I often see patients struggling with this. I have a lot of patients who are using at home kits of all sorts. And these kits are really everywhere. And they promise empowerment and control over your health. But are they really helping you, or are they adding more stress and confusion? In this episode, I'll share a real life patient story explaining what's happening behind the scenes with some of these tests, and more importantly, talk about healthier and more effective ways to monitor your wellness and reduce anxiety. So, let me start with a story, and maybe you can relate to this. I recently had a patient who was using an at home urine kit, a urine hormone test, while she was on the Mirena IUD. Now, for those of you who don't know, the Mirena IUD releases levonorgestrel, which is a synthetic form of progesterone. It usually works locally in the uterus to prevent pregnancy, but here's the key: it doesn't significantly affect hormonal levels in the blood or urine. So when this patient's hormone test showed high progesterone levels, she panicked. She started Googling up symptoms, worrying about hormone imbalances, and stressing about what might be wrong with her health. But the truth, some of these test results are misleading, and the anxiety it causes was really completely unnecessary. Unfortunately, this isn't a one off case. I'm really seeing more and more patients who are confused and overwhelmed by these tests, not to mention anxious, which ironically may make their health worse. So, what is the problem with at home testing kits? Let's break it down. Why are they not as reliable as they sometimes claim to be? Well, number one, there is no medical need for daily testing in some of these patients. And that's because the hormones fluctuate naturally throughout the day. And they also fluctuate during your menstrual cycles. Some hormones have what we call a diurnal rhythm, meaning they may change from morning to even night. So, testing this results every day, unless you're really checking it every second and continuously, you miss that cyclicity, and it can lead to confusion and doesn't give clarity. It adds a lot of noise and confusion. Okay. Number two, misleading results. Some of these tests, they measure hormones that are metabolites of the hormones they purport to measure in the urine or saliva. They're not the active hormones themselves. They're just the metabolites, the breakdown products of this. So if you are on a hormone contraception like Mirena, sometimes the test results may be really meaningless. Number three, some of these tests raise anxiety and stress. So here's a big one. Constant monitoring can make you hyper aware of abnormal levels that aren't actually abnormal. The resulting anxiety can drive up your cortisol levels and your body, which is your body's primary stress hormones. High cortisol triggers inflammation and may worsen symptoms like fatigue, weight gain, and mood swings. Number four, overdiagnosis and unnecessary intervention. Misinterpreted results can lead you to chase treatments or supplements or interventions that you don't necessarily need. Number five, lack of clinical context. Your hormones are complex, so a single test result doesn't tell the full story without professional guidance. It's really impossible to put the numbers into context, right? So here's the bigger picture. How do these kids add stress? Let's take a step back. The real harm isn't just the misleading data, it's what these tests are doing to your mental and physical health. When you are constantly worried about your hormone levels, you are increasing stress and anxiety. That stress pushes up cortisol, creating a vicious cycle of inflammation, hormonal imbalance, and fatigue. So instead of feeling healthier, you're left feeling worse. So here's a healthier way forward. Focus on real wellness. So what should you do instead? If you're feeling out of balance, anxious, or you just want to feel better, here are some of the things I would recommend. Try to manage your stress level. Practice mindfulness, meditation, deep breathing, because high stress can disrupt your hormones. So, finding ways to calm your mind is really crucial. Eating a balanced diet, right? Including fresh fruits, vegetables, nuts, and berries in your daily meals. These foods really support natural hormone regulation and overall health. Number three, move your body. Start with about 15 minutes of walking every day. It's really simple. It can create a big difference in your mental and physical health. One of the things I like to do, if you've been sitting for a long time, stand up and do some squats. You can do some squats, like 10 squats every 2 hours, might be beneficial for you. Prioritize sleep. Try to go for 7 to 8 hours of quality sleep every night. Sleep is where your body restores balance, and it also includes restoring hormonal balance. Number five, get professional guidance. If you're concerned about your hormones, don't just rely on a test strip. Talk to your doctor. Get a comprehensive evaluation, including blood tests, not urine, your saliva, real blood tests, and symptom analysis to get a much clearer picture of your overall health. So I'll leave you with this final thought. Empowerment comes from accurate information. At home tests may seem like an easy solution, but they often cause more harm than good. And the companies selling these kits need to do better. They need to educate users about the limitations of their products. And for you, the best approach to your hormonal health is not in the numbers, it's in living a balanced life, reducing anxiety, eating well, moving your body, and getting enough sleep, and also working with your doctor. So remember, hormones are complex, and true health is about the bigger picture. If you're feeling unsure, trust your doctor to help guide you, not a test strip. So, thank you once more for joining me on this episode of Fertile Talks. And if you found this discussion helpful, please share it with someone who needs to hear this. And don't forget to follow or subscribe so you never miss an episode. I'm your host, Dr. Yemi Famuyiwa. Until next time, focus on your health, not just the numbers.